The headline in today's New Orleans newspaper is pretty self-explanatory. No room at our inn. In this case, the inn is a hospital, and the numbers tell a devastating story. Only 41% of Louisiana's population has received at least one dose of the vaccine. 37% are fully vaccinated, one of the lowest rates in the country. At the same time, cases have surged more than 170% in the past 2 weeks. A dramatic influx of COVID patients that's forced one of the state's largest hospitals to stall non-emergency surgeries. My next guest is a top public health official in the northwest corner of Louisiana who says vaccine misinformation has public health workers feeling stuck. The New York Times reports, quote, facing deep mistrust that has been stoked by conservative news outlets and lawmakers and by rampant misinformation online, local health officials like Dr. Martha White are fighting for influence when the only sure strategy for beating back the virus is getting more people vaccinated. Dr. White considers herself a target at a time when many public health officials around the country have resigned or been fired during the pandemic. We are pleased to welcome to the broadcast the aforementioned Dr. Martha White. She is the medical director for Region 7 at the Louisiana Department of Health. We so appreciate you staying up with us. We know this is a very busy time for you. And I know you know that the state recorded an additional 6,225 new cases since Friday. That's one of the largest case counts since the pandemic began. So, Doctor, what's your view of the situation there tonight?
So we do feel stuck. We feel like we've been working around the clock to try to get people vaccinated. I don't believe it's an idea of access. I believe it's an issue of the people who have wanted to be vaccinated have been vaccinated. So now we're having to try to meet people where they are and figure out what their hesitancy is. And that runs a variety of issues.
So how much of that hesitancy do you say, okay, I understand this and let's talk it through? And how much of it is just crazy town? And what are some of the things you're hearing that are just out there that it's kind of hard to talk people back from?
So I think that it's really both. You have some that have historical fears. You have some people who have just general fears of medicine and medical procedures, needles. And then you have people who have heard all kinds of rumors on TikTok and the internet, social media, that have led them to really think that this is a government overreach or an issue that they don't want to take this into their system. Perhaps it's going to change their DNA, things like that.
And when somebody says to you something like that, well, I understand it's going to change my DNA, can you have success telling them what the facts are? I know you've stood up in meetings and people are angry and they really do feel that somehow the medical profession is, instead of trying to keep them safe, out to get them.
So it really depends on the person. Some people have really dug in their heels and it's really hard to reach them. I think you have to keep that approach slow and cautiously. Talk to them when they're at their limit with you. Then you take a step away and come back another day and talk to them again. There are some people who will listen, that you can talk through the truth about the vaccine, how it works, that it is a messenger RNA. It doesn't embed in your DNA. It's not gene therapy, and you can get them to understand and even agree to get vaccinated.
How are you holding up? I mean, I can't imagine that this is anything but, at times, incredibly demoralizing. I think it was the head of your state health department who said that the state has lost all the progress that it's made.
You know, I feel the same way. It's very disheartening. You work every day. We have a strong team, and they've really put in just working every day, multiple hours a day, 7 days a week. And we thought we were coming towards the end of those type of hours, and it feels like we're getting right back into them. You know, my husband was on a vent for 2 months. At the same time, I was doing all of that. And so I have a lot of fear of going back to those days again, where no sleep and a lot of concern about our community.
And your husband's okay now?
He is. He still has some post-COVID syndrome like a lot of people do, but he's a miracle and we're thankful he's here.
Well, and you still are going to work every day in spite of the fact that you say you feel like you're a target. And I was thinking about the doctor who wrote about the patients who were dying and then begged her for a vaccine. And she said she had to say to them, it's too late. And she was getting death threats. She felt like she was literally physically a target. What did you mean when you said you feel like you're a target?
Well, for the first time, I stood 2 feet in front of women who were cursing me and calling me names in the middle of a city council meeting, and I had to turn my back to them. And you feel very at risk. I had a lot of people who were protecting me, but it's still, you can feel that aggression. It's very palpable right now. And I feel like people have fear. They're afraid to go back to where we were. But they need to understand that they're in charge of how we move through this pandemic. We right now are in charge of how we move forward. If we do the right things, the things that we know work, we can move through this a lot more smoothly. If we don't, it's going to be a bumpy ride.
I hope people are listening to what you have to say. This is within our control. We know how to fix this. Dr. White, thank you for all you do, and thank you for being willing, in spite of everything, to stand up and speak out. We do appreciate it.
Thank you for having me.